Okay, good good evening and good morning. Thank you for joining. This is talk today. It's going to be this is one of the special talk from IWSP. How to prevent, manage, cure type 2 diabetes, preferably without medicine. So we'll have Dr. Susheel Sharma talking about this. I think we've run this session almost about a couple of months back. We had a lot of people liked it. And quite a few of them came back and asked us, can we do it one more time? So now we have added a few more details into this. So we'll be having this maybe about 30 minutes talk from Dr. Susheel, followed by, and he'll be answering all your questions related to this topic. So you can post your questions during the talk. Whatever the question comes, you can put it in the chat box so that we'll take them one by one. We may take a few minutes time until we allow a maximum number of people to join. We'll just look into some basic things. This is the IWSP, Integrated Wellness Science and Practice. They did a lot of, they're passionate group of people, passionate about wellness, hence they are doing it. I'm one of the volunteers. So they do a lot of lifestyle modification courses. They do another very important course. It's almost, they're about to launch it. Physiotherapeutic and yoga remedies for musculoskeletal disorders and back pain. This is one of the common issue. I think one of the statistics says about 1.8 billion people across the globe are suffering from musculoskeletal disorder. Almost about more than half of them are suffering from back pain. So there is a course designed by Dr. Mrityunjaya, and we have that. The lifestyle modification course, again, Dr. Susheel used to run it. So that is also already happening about 7-8 batches, and then now it's an e-module. They also do a lot of activities in terms of making people practice some kind of activities, yoga on a regular basis. Some of the therapeutic yoga also, they do that. So the whole lot of activities they do under the banner of IWSP. So some of the testimonials we'll see, and then maybe another.
Hello everyone, I'm Dr. Shweta Priyadarshini, and I am a practicing pediatric nephrologist at Apollo Hospital, Jubilee Hills in Hyderabad. So basically I have been associated with the SeriMed group since last few months, and through them I was introduced to the IWSP. Now when I started this program, I had a fair idea of what this program would have to offer. Basically, like, I'm a doctor myself and also have done quite a few courses in wellness, nutrition, lifestyle and all. But then this program was an absolute surprise for me. It was packaged in a very different way. The scientific contents have been presented in a very simple way, such that it makes you want to make subtle changes in your lifestyle and hence getting its benefit. So basically Dr. Susheel Sharma, he dissects the why of certain dietary habits in a beautiful way. And of course Dr. Swami Dayadhipananda also has a very calm command over yoga, and you will want to, after seeing the thing, you will want to practice yoga as a daily routine. And of course, Dr. Susheel Sharma's talk about stress management in life, that is so apt for the present circumstances, for the present generation. It's very, very beneficial. So this program, the beauty of this program is it does not preach, it does not tell you that, no, go ahead and do this, go ahead and do these changes to your life and it will benefit you. Of course, it tells you the benefit, but it does not dictate you. And it makes you want to bring those changes within yourself. And hence, the changes, I would say, they happen at a very subtle level, at its own pace. So, thank you so much, Dr. Susheel Sharma, Dr. Swami Dayadhipananda ji, and Anirban ji for this wonderful program. I wish you all success, and I just hope that it reaches out to as many people as possible and people benefit from it immensely. Thank you so much.
Hi, this is Sharath. I am working for Volvo Trucks handling marketing in India. I have always been interested in bettering myself, be it by reading self-help books or listening to lectures, or going to some programs which are conducted for better living. However, whatever I learned would continue for some time, but then gradually it will fizzle out. There wouldn't be any continuity. And being an engineer, I was always interested in understanding the science, the logic behind whatever I do before adopting it. So I was always wondering, pranayama and yoga or meditation, how good are these in comparison with whatever I have been following? Like I go for a jog, I go for cycling, which brings out the sweat in me. How can yoga or pranayama be better than any of these? So this IWSP program actually busted a lot of myths I have been carrying, or traditionally the information that has been fed into me, be it in terms of diet, for example. Whatever beliefs I had about milk or coconut oil, they were comprehensively busted. That no, this is how it is. These are the nutrients or ingredients in what you are eating. So know that before you consume it. It was kind of all the jigsaw puzzles I had was put in a single place in a holistic manner through this particular program. Finally, I would say it's a commendable effort by IWSP in conducting this beautiful program for this, I would say, betterment of this entire world. Definitely, I have been benefited, and I am sure, I'm confident that I'd be able to pursue whatever I have learned. I'd be able to put it into practice and be a better human being. Thank you.
I am Appanna Mudgi, Principal, SM Kaluti Composite Sports High School, Chandargi. Once I happened to meet Dr. Dayadhipananda Swamiji. I was suffering from diabetes since 12 years. He suggested me to join IWSP. I joined. When I am joining, my blood sugar was morning it is round about 160. After taking food it was more than 200 by taking 5 tablets per day. When I joined IWSP, after 2 months I tested in laboratory. My blood sugar was 120 without taking any tablet, and after taking food it is around about 140 to 160, and HbA1c also previously it was 9, but it is now 7.2 without taking any medicine. IWS programs strictly I am following. Morning I have to take one fresh coconut water, and for tiffin any one fruit, which is 2 to 3. Daily I have to change fruits day by day, and for lunch I used to take salad only. At 4 o'clock I will get 1 katori sprouted whole grain, and evening I am taking 6:30 dinner, that is 2 rotis and a katori of rice of siridhanya. By doing all this strictly, jogging for morning 1 hour and evening 1 hour, and yoga. By doing this without any tablet, my blood sugar level is 120, and after taking food it is 140 to 160, and HbA1c also 7.2. Just 4 days back I tested. So I must thankful to Dr. Dayadhipananda Swamiji and Dr. Susheel Sharma ji and the whole IWSP team. Okay, thank you.
Okay, so it was quick testimonials from few of the people who attended and benefited out of it. Next couple of minutes, I'll just talk about what is this lifestyle modification program, holistic wellness program is all about. So if you look at this is our pillar: diet, activity, stress, and habit change. These 4 are the pillars of any lifestyle illness. So what you eat, how you eat, when to eat, and then again, what is the level of activity and sleep is needed? What are the kind of activities needed for us? Stress management, another very important pillar of the lifestyle issues. And then habit change, very scientifically approached to habit change. How do you change your habit? You can't simply push and change a habit. Habit needs to be changed with a lot of background, a lot of scientific data behind that. So with this also we teach 16 asanas, 10 pranayamas, and guided meditation. So there's a whole package together is put in 12 different sessions, and people used to attend. And now it is happening in a e-module as well, that like you can see that. How do you join? If you want to have a look at more about it, please do visit www.myiwsp.com, and you have all the details in it, and you can subscribe through that also. It's a e-module platform also available, so you can attend whenever you want, wherever you are. You can attend and join, and you can practice yoga after putting on your those videos at any point in time you like to, because there's a lot of time differences in people. We have participants from across globe, so that's the reason we put it. And more importantly, one of the critical element is, it is not just given a program and done. Every single week, Sunday, India time 6 to 7, we connect back. All the participants will have their questions, and that get answered by these two doctors, our facilitators, who does it every single Sunday. It used to happen, and then gets repeated India time same in the evening as well. So it is the health coaching for the entire year. Any good practice you learn, and then you leave it. It'll again, after a few days, it'll go out of your mainstream. Hence we put it as a it has to be at least 1 year we need to handhold. That is what we are doing it. So we do have these application in both Google as well as Android. Both Android as well as iOS app, you have it. So these are the facilities of it. This is a helpline number. I will be keep putting it in your chat box, so you can view and you can connect with people if you need more details about it. So with this, we'll straight away get into today's talk. I know how to prevent, reverse type 2 diabetic. Karthik, over to you for sharing.
Topic: type 2 diabetes, how to manage. So before I go in great scientific details that I will with you, some things that you will hear will be new to you. Something you may know. Some things may inspire you. Some things may motivate you. Some things may shock you. But please remember, everything that I am saying or presenting to you is based on scientific data. So nothing here is an opinion. Everything is published in international journals, scientifically proven. None of this is my original creation. So some of you may not have good attention span as I do. So I want to get 4 cardinal facts, the 4 cardinal truths of this presentation out of the way in the beginning. And I'll repeat again in the end, because going through large number of details, you may end up losing the main thing. So what are the 4 important things? The first important thing that you need to remember is that type 2 diabetes is a lifestyle disorder. So that's the first fact. Now that takes you immediately to a second question. Hold on. So what's a lifestyle? Broadly speaking, what you eat, the way you move, the way you think, and the way you behave is what determines your lifestyle. So that is the second truth you need to know. 1, that type 2 diabetes is a lifestyle disorder. And 2, this is what we mean by lifestyle. What you eat, the way you move or not move, the way you think and interact with people around you, the way you behave, and that behavior brings in health habits that you have. That is your lifestyle. Okay, let me see how it clicks forward. Okay. Yeah. The 2 other facts you need to remember is unhealthy lifestyle causes diabetes. What is unhealthy lifestyle? Unhealthy diet, inactive living, stressful living, and poor health habits. So that is the third fact you need to remember. And the fourth, the last cardinal fact that you need to remember is that a healthy lifestyle can cure diabetes. And what is a healthy lifestyle? Healthy lifestyle is the one that has a healthy diet. It's an active lifestyle with exercise and yoga. It's a stress-free lifestyle, and it has healthy habits. So if you really look at in detail, as you will, going along, our program is basically based on these 4 pillars. These are the 4 areas of your health that we actually impact so that you develop a healthy lifestyle, you give up on a healthy lifestyle, and you cure diabetes. So remember these 4 things before we go into the details. So here is some of the statistics. I know that I'm presenting to you only the United States statistics because they're published by CDC and verified. I'm sure there are statistics in India, but I found them all divergent. So I'm not presenting here. Suffice it to say that if this is the statistics in the USA, the one in India is going to be either the same or probably worse. 1 out of 10 individuals in the United States has diabetes. And I'm sure it's the same in India. Out of those 10 people that have diabetes, there are 3 additional people that have pre-diabetes, which means they're only a few days or weeks or months or years away from becoming diabetic. So that takes you to 40% of our population. Out of 10 people, 5 do not know that they have diabetes. So of all the people that are there that have diabetes, half may not even know they have diabetes. And out of every 10 people, 8 do not know that they have pre-diabetes. So more or less 80% are at risk. So it's huge. It's way, way more huge than what you would think of. So let's contrast and compare it with what is really preoccupying us right now as the most important problem in our life. We're all worried about the COVID-19, right? Why? Because COVID-19 is an epidemic. What is an epidemic? Epidemic is something which is widespread in different areas of the world and is spreading. Well, so is diabetes. We're worried about COVID-19 because it's pandemic in the entire world. Well, if you look at the WHO statistics, the diabetes is prevalent in all nations on this earth and is a pandemic. COVID-19 will become and almost has become endemic, which means it'll be with us for a long time as part of our life in some shape or form. Probably we will win it, probably we will cure it, but it'll keep coming. So is diabetes. It's endemic. It's part of our life. So why is it that we are so worried? We give so much priority, so much grief it causes in us for COVID-19, and we do nothing about diabetes. Well, one thing that I could think of, I do not know what the reasons are, but one thing I could think of is it's immediate. COVID-19 can kill you immediately, and it's new. Diabetes kills you over a period of time, slowly, silently, and it's not new to us. That may be one reason. The other reason could be that diabetes, to diagnose, requires certain tests, visits, going to doctors, and COVID-19 declares itself by severe symptoms that you get right away. So anyway, whatever the reason, I just thought I should bring this analogy to some of you. COVID-19 may be important, and it is important to me, but I think diabetes should be equally important. Okay, pre-diabetes, I'm not going to go into the different tests because you can discuss that with the diabetes, but I'm just giving you the link. If you go to cdc.gov and take this test, and you will know whether you do or you do not have pre-diabetes. And this may shock you. This may shock you. A lot of you think that you may not have pre-diabetes, but you'll find out that you do, and you have pre-diabetes, you're only some distance away from becoming diabetic. So go to cdc.gov, log in, take the test, and you don't have to write down anything right now. I'll request Anirbanji to share this link with you at the end of the presentation. Okay, so act before it's too late. Before you become diabetic, you are pre-diabetic. And before you become pre-diabetic, you have something in your body got insulin resistance. Now, to some of you, this may be a completely new word. Insulin may be a new word, resistance may be a new word, and insulin resistance may be a new word. And I'm going to spend lots and lots of time today on this, because I believe that if you got the scientific truth and facts of insulin resistance very clear in your mind, you are only one step away from curing your diabetes, controlling your diabetes, and managing your diabetes. So please pay great attention. Now, I apologize from some of the participants who could be physicians who may find that my illustrations are very simplistic. And the reason is because I'm talking to a diverse audience, and I want to make sure that everybody understands what is insulin resistance. So first of all, understand this: food, sugar, consumption, storage. This whole thing has to be very clear to you. So you go buy groceries, you cook in your kitchen, you sit in a dining room and you eat, right? That is pretty much consumption of food. We do that every day in every household. We cook in the kitchen and we eat in the dining room. And that is how the food is consumed. Well, not all the food that we cook is consumed. Some of it is left over. So what do? The leftover food we put in the fridge. We put in the fridge because at dinner time, or maybe the next day or 2 days later, we can pull that out and add it to something else that we cooked, and we can reuse it. So that is the purpose of fridge. Refrigeration makes you store the food, not let it go waste, and reuse it at a later date when you need it. But what if you had a party in the house and you cooked lots and lots of food? You know that even if you put some food in the fridge, you may not be able to actually consume it all. You bag it in Ziploc bags and put that in the freezer. And what you put in the freezer, you can take out a month later, or 2 months later, or a week later, or a few days later, and use it in another party. And those of you who are housewives know exactly what I'm talking about. So very much the same way your body handles sugar. So just like in the kitchen and dining room you eat, muscles, your muscles actually consume the sugar. So all the sugar that you eat is used by your muscles in moving you, activity and all that. But then all the sugar is not consumed. So exactly like all the food is not consumed, you put in a fridge, your body's fridge with regards to sugar is your liver. So liver stores the remaining sugar as glycogen. And then if, let's say, day after tomorrow, you are not eating, but you need energy in your muscles for sugar, liver immediately supplies that short term. So that's liver's function. What happens to the food that's left over, or the sugar that's left over that you have not used? That gets stored as belly fat. So remember, I'll be using interchangeably 3 words: belly fat, truncal obesity, metabolic syndrome. They all mean the same thing. The belly fat is what is truncal obesity, and this is what causes the metabolic syndrome, all the metabolic problem that we're talking about. And diabetes is a lifestyle disorder, is a metabolic disorder. So remember this paradigm. So those of you who are not housewives may not understand this analogy, so I put it differently. For men, you all understand money, right? You go to work and you earn money. When you earn money, you spend money. You spend money on your daily expenditures, right? That's your expenses. But after expenses, you're still left with some money. What do? You put in a bank account. I can take it out tomorrow or day after or a week later. And then some of the money that you're still left with, right? You put in investments like stocks and bonds. And if you have even more money, you put in real estate, you buy properties and offices and all that kind of thing, right? That's how you store things. Pretty much that's what body does. You take sugar from your stomach, right? Goes in your bloodstream. From the bloodstream, it goes in your muscles. And I told you muscles are the ones that consume the sugar. So that's like your daily expenses. And then whatever is not used goes in your liver. So liver is like your bank and your investments. That's where you store it, short-term storage. And then your real estate, which is your long-term, you know, it's not very liquid, difficult to buy, difficult to sell. And that is your truncal obesity. The belly fat that you get, that is your real estate, which really causes the problem with lifestyle disorders. So all along, you must ask a lot of questions. And towards the end also, you'll raise these questions to me. And the questions may be going in your mind, oh, I need to know diabetes, I need to know pre-diabetes, I need to know insulin resistance test and all that. Well, I give you a very simple test, very simple, straightforward test, whether you do or you do not have a tendency to develop pre-diabetes, or whether you do or you do not have insulin resistance. Do simple thing. When you take a shower in the morning, put your underwear on, stand in front of the mirror sideways and look at yourself. If your belly button is way ahead of your chest wall, you have truncal obesity. You have insulin resistance. Now, you can also test it in the laboratory. There are very complicated, complex measurements of insulin resistance, but this is a simple poor man's test for insulin resistance. And remember, insulin resistance causes prediabetes and prediabetes causes diabetes. So whether you do or you do not have insulin resistance, you can know yourself standing in front of the mirror. If your belly button is ahead of your chest wall, you have truncal obesity. If you have truncal obesity, it's very likely you have metabolic disorder. It's very likely that you have insulin resistance. So this is again another way I'm explaining here. Insulin is required to transport this sugar. So remember I told you how sugar goes in different areas? But sugar is unable to go into any cell of your body without the help of a buddy, a friend. And the friend of sugar is insulin. Sugar, you can almost think about the sugar has to get married, you know, man and a woman. As a couple, they move. They don't move alone. So if you want to send sugar inside the cell of your body and you don't provide any insulin, the gate of the cell will not open. Cell will say, I do not accept sugar unless you come with insulin. So that is how these two work together. So the insulin drives sugar into the muscles consume sugar, and your blood sugar comes down and you're fine. If you're not using your muscles, what happens? It builds up. When it builds up, I told you, it gets stored in the liver and it gets stored as belly fat for long-term storage. So now you understand two things. You understand sugar and you understand insulin. So we'll see how I'm building it to the point where you fully understand what diabetes is: insulin, pancreas, sugar, liver, belly fat, insulin resistance, and where the cure of diabetes is. So if you have belly fat, I told you, you have insulin resistance. In addition to that, it causes two more problems. Actually, the belly fat causes inflammation in your body. And this inflammation also attacks your pancreas and creates pancreatic dysfunction, predisposes you to diabetes. This inflammation can attack the blood vessels to your brain and your heart, predispose you to stroke and heart attack. This inflammation can attack your kidneys, can attack your thyroid. So if you have belly fat, it is a factory that is producing pro-inflammatory chemicals in your body that are causing multi-organ dysfunction in your body. The belly fat now also, recent research says, produces certain hormones that can cause dysfunction in different organs of the body. So this belly fat is not a pure cosmetic appearance. It is not something that makes you look like that you don't want to look like. It actually is a storehouse of several problems: insulin resistance, inflammation, and certain deleterious hormones in your body. So let's understand insulin resistance in a very, very basic, fundamental way. This is a normal cell, and all the sugar in the body is consumed by the cell. If the sugar does not go inside the cell, you don't break it down, you don't use it, you don't get energy, and it's not utilized. So glucose says to a cell, I want to come in. And I told you, a normal cell will say, yes, you can come in, but not without insulin. Please come with insulin. So insulin is the one that opens the gate to the cell, and then sugar enters. And then the gate is shut and the sugar is used. That is how the insulin and sugar work together in taking sugar to the cell and consumption in the body. And this is normal, healthy body cell in everybody who is not diabetic. What happens to a cell that has resistance? Now, you can understand resistance in many ways. You may say that the door becomes jammed, or the door becomes rusted, or the key doesn't turn the door, or there's something inside which is pushing against the door and not letting you open the door. All that is resistance. So this is the most basic way to understand that some cells, instead of inviting sugar and insulin inside, start resisting it. It is like if you have a very good friend and he knocks on the door, you run to the door and open and invite him in. But if somehow you're not at very good terms, or somebody who has fought with you, he can keep ringing the bell, you don't open it. Because in your mind, you have a resistance. You don't want this man to come in. So now the glucose says, I want to come in. But the insulin resistance says, no, you can come in only if you bring more insulin. Why? Because to open this gate, hypothetically, let us say if 10 grams of insulin was required and now 100 will be required to push open the gate. You have to force open the gate. So what is happening here? When you're forcing open the gate, in every cell, you're needing more and more insulin. And not all the sugar is going in. So the first thing that is happening is both glucose or sugar and insulin in your blood is increasing, because you're recruiting more glucose and more insulin to break open every cell and go in there. But see where the problem is? The problem is with this insulin resistance. So if you don't understand insulin resistance, you will not have any understanding of diabetes. So what happens then? If the insulin is resisting, then I told you more sugar is needed and more insulin is needed to drive the sugar inside the cell. So your blood sugar rises. Now pancreas also has to release more insulin, right? More insulin. Your insulin rises, right? Now insulin causes one fundamental problem in the body. Insulin is the one that creates hunger and fatigue. This is a side effect. If there's hyperinsulinemia, if there's more insulin in your body, it creates more hunger and fatigue. Those of you listening who are diabetics and take insulin, type 2 diabetics, you will understand this very clearly. So you will remember when your doctor put you on insulin, you immediately became more hungry, more tired, you felt like you had to eat more, your sugar urge increased, and you put on weight. That is why the diabetics type 2 who are put on insulin, they gain weight, because this is the side effect of insulin. It causes fatigue and hunger. When the fatigue and hunger increases, what do? Your sugar urge increases and you're now taking more sugar. Now, more sugar you have taken, then there's more sugar in your blood. You're diabetic. So where did it all begin? It all began with insulin resistance. Right? So insulin is produced in the pancreas. So for a certain period of time, this will continue. You have insulin resistance, you need more insulin, you eat more sugar, and pancreas produces more insulin, and you stay in that insulin resistance pre-diabetes stage. But a point comes when the pancreas gets exhausted and it says no more insulin. I'm exhausted. It's damaged. Now you have diabetes. So you now fully understand where it all began. So now you might think, okay, so what are the markers of insulin resistance? How do I know if I have insulin resistance or not, right? One, I gave you a very simple, straightforward test, right? Stand in front of the mirror and look at your belly button. If it's ahead of a chest wall, a very high risk factor. People that have blood pressure, high blood pressure, also are predisposed to insulin resistance. Check your sugar. If it's a fasting is more than 100, you probably have insulin resistance because more sugar and more insulin is being needed to drive sugar in your cells. Check your triglycerides, fats in your blood. If they're more than 150, you have insulin resistance. Check your fasting HDL levels. I'm sorry, that's a mistake. HDL below 40 is a risk factor. And some of us have those dark skin patches on the skin tags. These are called acanthosis nigricans. These are also indirect markers of insulin resistance. So you can do some of these tests to know whether you do or do not have insulin resistance. So what are the risk factors? What is it that you do with your life that will predispose you to insulin resistance? If your diet is pro-inflammatory, you will have insulin resistance. If your life is sedentary and not active, you will have insulin resistance. If your sleep is poor, interrupted, and you don't sleep well, you will have insulin resistance. If you have high catecholamine state because of stress, if there's a lot of stress in your life, you will have insulin resistance. If you have poor health habits, like you smoke or you drink alcohol, you will have insulin resistance. So some of you smart enough who have been with us for a while may know our DASH program. Remember our DASH program that we do in IWSP? It's exactly the top 5, right? D for diet, A for activity, S for stress and sleep, and H for habits. So in our program, we attack all 5 risk factors for insulin resistance. And once you attack these 5 risk factors, the next risk factor is the weight, obesity. And that also gets cured when you do the DASH program and the IWSP program. So if you look at the risk factors, 1, 2, 3, 4, 5, 6 top risk factors are completely optimized, eliminated from your life. Your insulin resistance improves, and that is how our program improves your diabetes. Now, the other 3 that I mentioned at the bottom, unfortunately, these are called non-modifiable risk factors. No one can improve them. It's a given fact that every year your age will increase. Nothing can change it. If you have family history, you have a propensity to develop diabetes, you cannot change it. Ethnicity, certain races and Indians have higher insulin resistance compared to, let's say, Caucasians. So your ethnicity predisposes you, being an Indian predisposes you to diabetes. So these are the 9 risk factors for insulin resistance. 3 at the bottom are non-modifiable. 6 at the top are modifiable, and our program modifies all 6 of them. And that is how it improves insulin resistance, eliminates prediabetes, eliminates diabetes. And that's exactly what we mean by the fact that diabetes is preventable, curable, and modifiable. Okay, so these are some of the studies. So look at how weight loss improves insulin resistance. Exercise improves insulin resistance. If you are overweight, your BMI is more than 25, you have belly fat, your diabetes risk goes up by 700%. If your BMI is over 30, it goes up by 4,000%. But if you cause even 10% reduction in weight from wherever you are, you may be 60 kilos, 80 kilos, 100 kilos, 120 kilos. If you lose that weight by 10%, you reduce your diabetes risk by 50%. Although we recommend that you come to ideal body weight, but just 10% reduction can give you so much benefit. So you don't have to become slim and trim to reduce the risk of diabetes, just 10% loss. But that loss through weight and exercise combined is better. So if you 30 minutes of brisk walking daily lowers your risk by 34%. So if you increase your fit time, which is walking time, active time, and cut back your sitting time, you reduce diabetes risk by 34%. TV. So this is published from a study. People that watch TV 2 hours a day, their diabetes risk goes up by 20%, heart disease risk by 15%, premature death by 13%. So you know it. If you are spending 2 hours a day in front of TV, and mind you, 2 hours is not a whole lot. One soap opera is usually 1 hour in India, 20-30 minutes of news and 20-30 minutes of something else. And here you go, it's 2 hours of TV. Sitting in front of TV for 2 hours is a risk factor for diabetes, heart disease, and premature death. Smokers, please pay attention. If you quit smoking, if you're smoking right now and you quit it, you lower your diabetes risk by 50%. So this is how much difference the cigarette smoking and quitting makes to diabetes. Okay, so to put it all together, how do we then claim and preach and teach that we help you control and reverse diabetes? We do it through this program. It's called Integrated Wellness Science and Practice. It integrates you as a human being in your family, in your life, in your work, in your society. It integrates different organs of your body. You'll be amazed how different organs of the body are so integrated, and if you don't maintain and respect integrity of those, you'll have a problem in life. The moment you put food in your mouth, right? Immediately the sugar goes in the blood. Sugar goes in the blood, then insulin gets released from the pancreas. The liver starts storing, the muscles start consuming, the belly fat starts taking sugar. All this is happening in all these areas, different 4, 5, 6 different organs activated. How are they working together if they're not integrated? They're all integrated. But if you make one of them sick, like pancreas, then all 4 or 5 of them become dysfunctional. So integration is the hallmark of wellness. And that is why we do integrated wellness. You also integrate socially, personally, and individually. You know, we all talk about stress, right? And we deal with stress in a great detail in our program. And again, not leading an integrated life is a very important cause of stress. I give you a very simple paradigm here. I'm not going to go into much detail on stress here because we spent 2 full sessions on stress. Just watch yourself from today. Whenever you feel stress, watch yourself. Just sit back and think, had it anything to do with the way I act, the way I interact, and the way I react? Now, it may not be possible to change that in one day. It may take a long time, but you'll find out that the root cause of all the stress is in the way we act, the way we react, and the way we interact. If these 3 are changed, then stress level comes down. It may take a long time to change, and the change actually happens when you change habits, and habits take a long time to change. And when all the habits change, the personality changes. When the personality changes, that is when stress goes away. So more of that later. Focusing on wellness, you don't have to focus on the wellness of just taking this medicine or just doing this practice. It's a holistic wellness. You are as well and as sick as one cell of your body. You have to think about the wellness of every cell. Do you know all cancers begin with one cell becoming dysfunctional and multiplying in an erratic way, and then becoming a growth and a tumor and a cancer and then spreading to the whole body? All began with one cell. So you're obligated to take care of every cell of your body to have holistic wellness. And that's what we focus on. We only give you scientific facts, the one that is published, verified, and verifiable. You learn the facts, you experiment them in your life, and you experience and you draw your own conclusions. There is nothing that will be given to you in this program which is hearsay, opinion. It's not a mat. It is not a belief. it's science. And we focus on practice, focusing on practice individually, focusing on practice collectively, and focusing on practice in a continuous, uninterrupted way as part of IWSP life. And that is how the whole program is structured to bring in the lifestyle change. Our objectives are, we give you didactic lectures from which you learn. We inspire you to experiment with the facts that you have learned. From that experimentation, we want you to draw your own conclusions and your experiences. And if that experience is positive, you put that into practice and bring about a change in lifestyle. This is the core of the program. We call it Dash to Wellness. There is a certain diet, I told you, which is pro-inflammatory and causes lifestyle disorders. And there's a certain diet which is anti-inflammatory. So once you attend the program, you will look at food in a different way. You will look at food not as what is good to my palate, not what I find available, not what everybody around me eat, but the food that is anti-inflammatory, the food that integrates my health, the food that creates wellness of every cell of my body, the food that reduces my stress, the food that helps me change my health habits. That is going to be the diet. You will learn staying active and its benefits. You will learn sleep hygiene. Most of you who are not sleeping 7 hours a day are predisposed to lifestyle disorders. To have good, uninterrupted 7-hour sleep is a must in 24 hours. And to do that, you have to follow good principles of sleep hygiene. And if you're not following those, there will be a predisposition to diabetes. Stress management, I briefly discussed, and habit change. And habit, smoking, drinking, poor diet, sedentary lifestyle, excessive TV watching, spending too much time with social media and WhatsApp and those kind of things. They're all habits and they don't change overnight. And you don't change habits unless you understand the science, how the habits form, why it is so difficult to change the habit, and what are the fault lines in that habit loop where you can actually interface, put a block, and hack the habit loop and change the habit. And we discuss that in detail with you. So once again, to recap, I told you a lot about diabetes, pre-diabetes, and insulin resistance. Again, I'm re-emphasizing those 4 cardinal facts that I gave you in the beginning. Number 1, type 2 diabetes is a lifestyle disorder. Your lifestyle is what you eat, the way you eat. If you move or you don't move, you're active or inactive. The way you think, because your thought process eventually leads to stress in your life. And the way you behave, your behavior is the foundational block of your habits. And if your habits are unhealthy, you have a lifestyle disorder. Unhealthy lifestyle has poor diet, inactive living, stressful living, and poor health habits. That is what causes lifestyle disorders. That's what causes diabetes. And if you reverse that and go to a healthy lifestyle and change your diet, that we'll discuss with you in detail. We actually dedicate 3 full 1-hour programs to what we think is a healthy diet. Active life, which has activity, yoga, gym, sports, walking, all those kind of things. Stress-free living and healthy habits will cure lifestyle disorders and will cure your diabetes. So remember, what you're going to plant today is what you're going to harvest tomorrow. If poor health habits, poor diet, poor activity, and stressful living is what you're planting today in your life, then you're going to harvest lifestyle disorders tomorrow. And remember, you can have a goal. And this is January, a lot of us make New Year resolutions and all that. If you have a goal, but you do not have a plan, it's only a wish. And the wish does not make you reach goal. The plan makes you reach goal. We have a plan. It's a whole comprehensive, holistic plan that we have that spans over a period of 3 weeks. You will have 3 days a week, didactic lectures, live yoga, instructions, participation, connection, that will give you all the knowledge that you need. And then you will begin the IWSP life, which is every 2 weeks reinforcement that we do, where we discuss things in more detail and also reinforce and answer questions when you have certain problems with certain practices. So this takes about a year. So if anybody tells you that he went to a lecture, learned something, and his diabetes is cured, not possible. You learn something, then you experiment with it, then you experience, then you practice, and that practice takes time. So in order for you to reverse your diabetes today or control your diabetes today, it might take you weeks, months, and years. It's not going to happen in one day. And that is how the program is designed. Today, you just heard about the program. Once you attend the program, you will invest 3 weeks of your life in learning, and then you will dedicate 1 year of your life, once every 2 weeks for an hour, to reinforce everything that you learn. And that is how your lifestyle is going to change. And that is how your lifestyle disorders are going to be reversed. And that is how your diabetes is going to be managed, cured. Thank you very much. Thanks for listening, and I'll take some questions now.
Thank you, Dr. Sharma. Dr. Sharma is actually there with us online. He's traveling, and Swami Dayadhipananda is also there online. Karthik, can you make Dr. Sharma as well as Dr. Dayadhipananda ji as a co-host and pin both of them? Oh, yeah, great. Thank you. With this, someone have raised their hand and you want to ask question. Karthik, can you help? Okay. There are 2 participants raised their hands. Can we unmute them? They can put their question directly. Usha as well as Ramulu. Yeah, Usha ma'am, you are online. You can ask your question.
Yeah, good evening, doctor. It was a very informative program. I enjoyed it actually. I'm diabetic actually. My question is, when I had COVID, my doctor, who was internal medicine, who was an assistant professor in Chengalpet Medical College, he advised me to take insulin. I used to take only medicines. I never used to take insulin. But he told, because corona spikes sugar, you have to take. I refused, and I asked my blood sugar to be checked immediately. So immediately they checked, and it was 190. And he told, okay, 190 is not very bad, so don't take insulin, continue with your medicines. My question is, if we start on insulin, is it that we'll end up with insulin?
Well, the whole idea is, if you are not producing insulin and your sugars are high, that is what your doctor is going to tell you. Control your sugar with artificial means, which is insulin. But once you go to lifestyle modification program, do the proper diet, be active, control stress and habits, your need for insulin is going to drop and you will not need external insulin. There's one more thing you need to understand. If you replenish insulin from outside, then you're making your pancreas lazy, because pancreas think, oh, well, I'm getting it from outside. Why should I work hard to produce more insulin? So I think the rejuvenation of pancreas gets delayed. But if there is a very high sugar for a certain period of time, you may have to take insulin, and that is a necessity. But the whole idea is not to take insulin and have your pancreas recover.
Thank you.
Hello.
Yeah.
Hello. Good morning, sir. Good evening, sir.
Go ahead.
Hello.
Good evening.
It is very useful program, sir.
Put your question, sir.
I am a pre-diabetic, sir. How can I reduce my pre-diabetic?
Yeah, so you do reduce your pre-diabetic status by actually doing all the things that we discussed in our integrated wellness science and practice program, by instituting changes in those 5 areas of your life: your diet, your activity or inactivity, your sleep patterns, lack of sleep, your stress, and your habits. and we take each one of them individually and discuss in detail. So once you modify those 5 things, your diet, your activity, your sleep, your stress, and your habits, unhealthy habits, you're on a road to recovery. Then the insulin resistance improves. When the insulin resistance improves, then your prediabetes improves. And that is how it works.
Thank you, sir.
There are quite a few people who attended this our session in the last 1.5 years. They've actually reversed. They were on insulin. Now they're not on insulin. They reduced the number of the dosage of medicine as well. So we have a lot of people in the same our meeting itself who did that actually. Mr. Bharat, you can go ahead.
Yeah. Good evening, doctor. Fantastic lecture. The way you have covered from starting to the reasons and no words how I can explain the way you could make us the importance of it and how we should follow. Fantastic. Doctor, I do have a small question. See, you say this DASH program is required for this diabetes control. Can you suggest what percentage of diet, activities, stress, and habit management leads to the diabetes?
See, they all work collectively. So we don't need to dissect each one individually because our whole program is holistic. So we look at things holistically, and together, these are the 4 important things. And you really have to improve all 4 collectively in order to get the benefit and reverse your diabetes and reverse your insulin resistance. Each one is equally important compared to the other.
Fantastic, doctor. You have given a totally different, the way we have struggled with generally taking medicine for the prescribed by other doctors. You have given a totally different approach how we should tackle the problem. Thanks a lot.
Thank you.
Thank you.
Sandhya ma'am, you can.
Yes, sir. Thank you. So just I want to ask a question, whether it is a good idea to avoid carbohydrates when we are diabetic.
So Sandhya ji, again, as I said, we look at things holistically. We also look at the nutrition holistically. We don't look at nutrition in terms of carbohydrate, fats, and proteins, and minerals, and vitamins, and those things. We really look at as a whole. What is a whole holistic nutrition that is going to reduce inflammation in your body, make your inner organs recover, and change lifestyle disorders? So our approach is not piecemeal. Our approach is collective, holistic. So when you do the diet that we're talking about, all the organs of your body improve. It's not, if you're diabetic, it just doesn't mean that you to control your diabetes and you'll be fine. No. Whatever predisposed you to diabetes will also predispose you to heart disease, to blood pressure, to high cholesterol, to stroke. So you really have to do the holistic approach and not look at each food item individually. And if you do the diet that we tell you, you see your change in parameters in all these lifestyle disorders.
Thank you, sir.
Dr. Nalina? Karthik, unmute. Dr. Nalina.
Yeah, I have been trying to ask her to unmute. She has to unmute from her end.
Okay.
Been asking her. She has to press the unmute button.
Okay. We'll move on to a few other questions. Let us come.
She can speak now, yeah.
Yeah, go ahead, ma'am.
Good evening, sir.
Good evening. Good evening.
What are the food we have to take, sir? Exact food, sir.
Yeah, Nalina ji, that's exactly in this program. We just discussed with you the outlines. We devote 3 full sessions, 1 hour each, to exactly to what food to take, what food not to take. So once you attend the program, you'll get a comprehensive knowledge of what to eat, what not to eat, and how to eat, and when not to eat. All right, Nalina?
Okay, sir. Okay.
It's almost 3-hour discussion, ma'am. That's the reason we cannot cover it in few minutes. So the program will help you exactly what to eat and all those details. So I'll go to chat box for a few of those questions. Dr. Susheel, this question is, why postprandial glucose test is tested with the 75-gram glucose?
Well, it depends. Some people do with 50, some with 75, or 100. The whole idea is to stress your pancreas and see if you can or not to bring the test. We're not talking about test here. We're talking about how to prevent this diabetes from coming. So different people do it differently. So you should not pay much attention to that.
Okay. So we were talking about the central obesity linked with the diabetes, but a lot of lean people are also getting diabetes, right?
Yeah. So again, I mean, central obesity is one of the manifestations of inflammation in the body. You can have no belly fat and still have inflammation, and then can have insulin resistance as a result of that, and diabetes. So that is why we recommend that you really need to do this holistic approach to reduce inflammation from your diet, inflammation from lack of activity, inflammation from stress, and the inflammation that comes in the life from poor healthy habits. And if you use inflammation, you will have the benefit and you will reverse the diabetes.
Okay. So there is a chance for even a lean people gets it. It is not necessary only for people with central obesity. Another question, what is the main cause of insulin resistance?
Well, as I discussed with you, there are several factors that lead to insulin resistance. One of them is lack of physical activity. Other is poor diet. Other is a lot of stress in life. And the other is poor healthy habits. So all of them get combined. And there is also some genetic predisposition that goes into insulin resistance. And then health habits like smoking goes into that. Family history goes into that. So these are all the factors that cause insulin resistance.
Right. Another question, I think Swamiji is a great person to answer for this question. Difference between type 1 and type 2 diabetes, Swamiji?
Yeah, we have heard all about diabetes. Type 1 diabetes is an autoimmune disorder where body has failed to produce insulin. Usually a boy or girl less than 30 years of age can get type 1 diabetes until unless it is proved otherwise. So if you have got any boy or girl less than 30 years of age, newborn to 30 years, if the sugars are more than 300, serum ketones are positive, it's type 1 diabetic until unless proved otherwise. So if somebody is on type 1, diagnosed with type 1 diabetes, he must be on insulin. There is no alternative. Type 2 diabetes is completely a lifestyle disorder. It's not an autoimmune disorder. And depending on the case, in the beginning, we treat with tablets, then maybe required insulin. And as we are focusing in this program, how to reverse that, because it's a lifestyle disorder. So if you can take care of these lifestyle disorders, you can definitely reverse type 2 diabetes. Even children with type 1 diabetes, when followed this healthy lifestyle taught in IWSP, their insulin requirement came down. And out of 300 children that I see every day, type 1 diabetics, there are more than 10 children whose insulin requirement has come down almost to negligible, up to zero. Yeah.
Yeah. So just to inform to the rest of the participants, Swamiji is passionate in type 1 diabetes, and a lot of kids, almost 300 kids are, Swamiji is supporting them. And we see the post here and there, their insulin level is keep going down. So we are wondering that even type 1 diabetes is reversible. That is what Swamiji is trying to do. That Swamiji is doing a great job in that. Swamiji, throw a little more lights on specific asanas which is linked with the type 2 diabetes or in general diabetes, and how the program can help people.
When we talk about yoga, yoga as a way of life, it should be taken as like that. So when we focus on the postures, body postures, the main focus is to stimulate our pancreas, the abdomen, left side is the liver, left side is the spleen, behind the spleen is the pancreas. Pancreas is the organ which secretes insulin. So Mandukasana, put pressure on abdomen wall, bend forward and do Kapalbhati. And there are many more asanas which we teach in our program IWSP. If you can practice those asanas, definitely it helps to bring down the insulin requirement, bring down the tablets that we take for our diabetes. So as a whole, we have to practice. So all the asanas and pranayamas that we teach in our program have immense health benefits when it comes to lifestyle disorders, and diabetes is one among them. In particular, practice more Mandukasana, Shashakasana along with Kapalbhati. If somebody can practice continuously for 20 to 30 minutes Kapalbhati, it's great. So focus more on Mandukasana and Kapalbhati, along with many more asanas. Yeah.
Thank you, Swamiji. So all these things are taught in the program. with the guidance of Swamiji by another practitioner who teaches. And then Karthik has put Dr. Susheel was talking about CDC test, and the link is there. You can test. I already tested too. The next question is, Dr. Sushilji, what are triglycerides, what its use, and how it relates to diabetes?
Yeah, so triglycerides, just like cholesterol, is another type of fat. If it's excessive in your blood, it predisposes you to stroke and heart attack. Unfortunately, triglycerides go high when there is a lot of sugar circulating in the blood, especially in diabetics, because they cannot take care of all the sugar. It ends up in the liver being converted to triglycerides, and the triglycerides level go up. So it is pretty much the same thing as cholesterol. There's more data coming out now, and there are also medicines that can actually lower triglyceride and reduce the risk of heart disease. But the best way to lower triglycerides is by doing DASH program and reducing inflammation in the body, taking the right diet, increasing physical activity, losing body weight, getting rid of stress, and changing your health habits. And that is the way to really take care of triglycerides.
Thank you, Doctor. And Smita is asking, is this course given online? Yes, it is online. Now you have a e-module. So you get an Enroll, and then you get an access to that for 1 year. Every Sunday between 6 to 7 a.m. India time, and then same 6 p.m. to 7 p.m. India time. We do it over Zoom, where both Swamiji and Susheelji will be live, clarifying all our doubts, and then there will be some additional topics will be covered. It is, I mean, you don't see a program like this. It's a mere nothing. Our objective is to reach out to maximum number of people. And it is done 1 full year of hand-holding with so much of data, so much of guidance and support and coaching. That is what it is happening. Answer to you, yes, it is online.
Just to add, Naresh, I think our team, Smita ma'am, will get in touch with you. We have your details because you've registered on Zoom, and we'll particularly get in touch with you and try and see if you can join the program.
Yeah. Next question is, how does HbA1c reduces though the person is having walking and in diet? That's Swamiji. I think Sushilji is traveling.
Yeah. So I understand they want to say that already I'm following diet and already I'm walking. Still my HbA1c is high. How to reduce it? So first of all, you have to take proper treatment. So if you are not having sufficient medicines to control your blood sugars, first your medicines has to be adjusted. So then if you think whatever exercise you are doing, that's enough, maybe it's not enough. If you understand our program, you will learn more to do with exercise. Similarly with diet. So that's where again our answer is, if your HbA1c is high, you have to undergo this program. There is no alternative.
Thank you. To some of the new participants, Swamiji is also a doctor by profession, just giving additional information. So Swamiji, how to improve sleep?
By cultivating good habits. Do not see what should not be seen. Do not hear what should not be heard. Do not do the things which are not good for you and for your family. Hari, worry, kari, we use 3 words. So try to do all your work throughout the day in a calm, quiet mind. Do all positive, think positive. Once you are done, forget it. Do not carry any load, your office load to your home. Once you come back home, try to pray, finish your evening dinner a little early so that you will get at least 2 hours for digestion. Then go to bed early and put off all the TV screen, mobile screen, stay away from them because that keeps on stimulating your brain. So again, all these things are taught very in detail about in this program. I think you have to attend the program.
Yeah, I think one of the days we dedicate for sleep hygiene. We talk only about how to sleep and what are all the things to be taken care. So you will definitely enjoy that. Please do join. And then Dr. Lalita says that, Doctor, we have our homeopathic mother tincture to improve insulin. It's more of a comment.
Yeah, if you believe in homeopathy, please go ahead. Use all the methods that can help to control your blood sugars.
Right.
That's what is integrated wellness is all about.
Another question, Swamiji, why doctors prescribe blood thinner to diabetic patients and explain its relationship, if any?
So as already explained, if your blood sugars are on the higher side, your body has a tendency to produce more and more triglycerides and the bad cholesterol. If the bad cholesterol LDL is high, your triglycerides are high, there is more chance that you will get your arteries thickened, the arteries gets blocked. That's what is called as heart attack. So ecosprin, blood thinners are used to see that your blood vessels are not getting thick walled or blocked to prevent the block. So again, if you can practice IWSP, definitely you will not require. Yeah.
Thank you so much, Swamiji and Sushilji. I think since he's traveling, the network should have gone. So I think we are done with the question. Anybody would like to ask question by unmuting yourself? We have another 1 or 2 minutes we can take. All right.
Pradeep Simha, you are there? Pradeep Simha.
Someone.
Riya. Please ask, unmute and ask. Please unmute yourself. Riya. Yeah, please ask. Riya, please ask. You have to unmute. Yeah, now you ask.
Sir, what's the pre-diabetes and type 2 diabetes value? Like the number?
HbA1c between 5.8 to 6.4 is pre-diabetes, borderline diabetes. If your HbA1c is between 5.8 and 6.4, you are in pre-diabetic state. You have to take care so that you bring down your HbA1c less than 5.8. Yeah. Anything more? Any more questions, Riya ji? Pradeep Simha is there?
Swamiji, I'm trying to search him. Yeah, he's there, sir.
Yeah. If he's there, he can unmute and share his experience, how IWSP helped him to reverse his diabetes. If he's not there, anybody else who would like to ask any more questions? And we have Shaila Shankar. She can come and share her experience, how IWSP has helped her to control her diabetes. Her doctor asked her to go on insulin. She joined this program, and now without insulin, her blood sugars are perfectly all right. Shailaja Shankar. Anybody else? Anybody have any more questions?
I think we are done with the questions.
Okay.
Request others who are first time attending this talk and look into our website, and please do connect with us in case if you need any help. We'll help you out. Join, and then we'll connect. There's a community of people who connects every week, and then there's a lot of interaction happens, a lot of sharing happens. A lot of people put different nutritious, healthy plates on the WhatsApp group. People enjoy and understand the recipe, and they share it. It's a community. So this is what we welcome everyone to join.
I think Shailaja Shankar is there. She can unmute and talk and share her experience. Please unmute yourself, Shailaja.
Yeah, thank you.
Yeah.
I started the IWSP program about, I think, batch 4. So I would say it's almost about 10 months ago. And before that, I've been a diabetic diagnosed with type 2 diabetes for the past almost 22 years. And, although I was exercising and then I was not following really the actual diet, and then I was exercising, but still my medication seemed to increase over the period of time. And I think my doctor the last year told me that I need to go on insulin. So because what she said was that people with diabetes, they develop insulin resistance, and then more and more medication is needed, in order to control their diabetes, the blood sugar. And I was really worried, and I told her, give me. I mean, this was around the time I was introduced to IWSP, and I followed the DASH program taught to us during the IWSP program, diet, exercise habits, and then practice yoga, pranayama, habit change and all that. So with that result, within 6 months, my diabetes, I came to pre-diabetic level. At that point, I think my blood sugar HbA1c was about 7.2 or 7.4. And then 6 months of practicing IWSP, my sugar level came to pre-diabetic level, which was 6.4. So 5.4 to 6.4 is pre-diabetic level. And this, this after having diabetes for 22 years, which I thought was never possible. And then my doctor was also very surprised. And then she reduced my medication by half, and she completely took me off of one medication. So now I'm still on the basic metformin, which they give, and it's very difficult after 22 years that I'm still on just the basic metformin. And then at night she's given me Unliza just to, and that Unliza is not the first type of medication for the diabetes. So it's just a supplement to keep the pancreas cells in the pancreas. So I'm very happy with this program, and I highly recommend this to everybody. And I'm still working on it. I continue to be a life member and attend all the sessions. My goal is to reverse my diabetes. Thank you very much. And Swamiji and Dr. Sharma have been very, very helpful. And all the IWSP conductors like Naresh, Anirban Datta, and Karthikeyan, they help you with reaching out to them, and any questions you have, it's promptly answered. So there's a lot of support in this program. I'm very happy, and I highly recommend this program to everyone. Thank you.
Thank you so much, madam. We're happy to see you again that you are in the right progress. With this, Swamiji, thank you so much for your time and and enlightening us. Thank you. And all of you, please do connect with us wherever you need help. With this, we'll close today's session. Have a good night and a great day for all US participants. We'll catch up again in another session, may happen in another 15 days from now in a different topic. Possibly next time it's going to be hot. We'll again share all the links and share it, join again with us. Thank you. Bye.